Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a Program Director, Internal Medicine Residency Program and a Chief Medical Officer. Today we're going to continue our topic of in-service training examination for internal medicine residents, okay? There's around, I think, more than 10,000 internal medicine residents. They have to go through this grueling IT exam. A lot of times people don't have the time, people don't take it seriously, but the impact is huge. As a program director, they look at everything, and one thing they usually follow is your in-service training exam. Okay, take your time, and these are the topic people usually miss in the in-service training exam score. So again, these are the topics you have to review before you go take it. And today's topic, causes of hypercalcemia. We start with a good clinical case or a question. A 65-year-old woman present with fatigue, constipation, calcium of 12.8, PTH 85, phosphorus is 2.1. What is the most likely cause of hypercalcemia? There are four options: primary hyperparathyroidism, vitamin D intoxication, malignancy-associated hypercalcemia, and familiar hypocalcemic hypercalcemia. Okay, so the correct answer is primary hyperparathyroidism, because you got elevated calcium, elevated PTH levels. So PTH mediated hypercalcemia, primary hyperparathyroidism is the answer. Now let's look at some of the common causes. If it is PTH mediated, you have to think about primary. The first thing you always have to think is the primary hyperparathyroidism. You can see familiar hypocalcemic, hypocalciuric hypercalcemia, tertiary hyperparathyroidism. Okay. Now, that is the PTH related. That's why you always check the PTH first when there is calcium level high. Then you have non-PTH. When you talk about non-PTH, you have to think about malignancy, my friend, okay? Always PTH related parapeptide you have to check. Vitamin D intoxication and the medication, and the other causes here, the milk alkali syndrome, immobilization itself, and the hyperthyroidism also. So parathyroid PTH mediated causes, again, primary hyperparathyroidism, familiar hypocalciuric hypercalcemia, and tertiary hyperparathyroidism. Okay, now non-PTH causes, malignancy, my friend, common lung and the breast, PTH related protein secretion, so you have to check the PTH related peptide in this. Vitamin D intoxication, a lot of people are like loading up of vitamin D because somebody made a research and said if you take vitamin D your life is going to get better, but I'm not going to go into the details on that. Medication, thiazide diuretic and lithium therapy. Thiazide diuretic, a lot of people taking for blood pressure. Okay, other causes, milk alkali syndrome, excessive calcium use. Where does this come from? Antacid. You get a lot of calcium carbonate, immobilization. Prolonged immobilization lead to calcium efflux from the bones, and hyperthyroidism, increased bone resorption due to the excessive thyroid hormone. Okay, so we have a mnemonic for calcium hypercalcemia. The mnemonic name is calcium rice. Okay, let's look at the C is for calcium, A is for Addison's disease, L is for lithium therapy, C is for calcium supplement, I for immobilization, U for underlying infection like TB, and then M is for milk alkali syndrome. And then you got the rice, R for renal failure, I inflammatory disease like sarcoidosis, granulomatous diseases, S is supplement, that means vitamin D intoxication or vitamin A toxicity, E is endocrine disorders, hyperparathyroidism and thyrotoxicosis. Okay, let's look at one more question. A 58-year-old man with history of lung cancer, present with confusion and weakness. Calcium is 14.5, PTH is normal, albumin is 4.0. What's the most likely cause? If you look at this question, you see PTH is normal, right? And the primary hyperparathyroidism, milk alkali syndrome, malignancy-associated hypercalcemia, thiazide diuretic use. This is a malignancy-associated hypercalcemia, severe hypercalcemia, suppressed PTH, patient with a history of cancer. So you have to check the PTH related peptide. Okay. Now, another question, a 50-year-old woman with hypercalcemia, been taking calcium carbonate for indigestion. Calcium is high, PTH is normal, bicarbonate is 32. So in this patient, primary hyperparathyroidism, milk alkali syndrome, familiar hypocalciuric, hypercalcemia, and vitamin D intoxication. Those are the 4 choices. Your answer is milk alkali syndrome. They're taking combination. If you look at, there's combination of hypercalcemia and metabolic alkalosis because you elevated calcium, elevated bicarbonate is to excessive calcium carbonate. Okay, so uses the diagnostic of milk alkali syndrome. That's another beautiful exam question. Then you have a 40-year-old person with hypercalcemia, had parathyroid surgery that failed to normalize. Calcium is high, 24-hour urine calcium is high. PTH is also high. What's the diagnosis? You got 4 choices here: primary hyperparathyroidism, familiar hypocalciuric hypercalcemia, tertiary hyperparathyroidism, vitamin D intoxication. Your answer is familiar hypocalciuric hypercalcemia, characterized by mild hypercalcemia, inappropriate or normal, could be, or in this case, a slightly elevated, low urine calcium excretion. If they give you low urine calcium excretion, pick up familiar hypocalciuric hypercalcemia. Okay. Now we just added another, an algorithm is going to help us. What's the first thing? First thing, always you check the PTH. Okay, and if the PTH is low, then always think malignancy first, and then you check the PTH related peptide. And then if it is low or normal, then you have to think about vitamin D, and then if the vitamin D level is low or normal, and then if it is, if you check the vitamin D is high, then you have to think about lymphoma, or you have to think about granulomatous diseases. It's very simple up here. So look at this diagram, and on the other side, if the PTH is high, if it's primary hyperparathyroidism, then you check the calcium. If the calcium is in the urine is less than 100, that's a familiar benign hypercalcemia. We already said there's a question that, and if it is high, it's primary hyperparathyroidism. Okay, and so always think about all these examination questions. Study well for your in-service training examination. Take it very seriously. God bless. Please subscribe to our channel. Thank you.